Hi everyone, Dr. Luqman here with Excited Cats, bringing you another exciting cat topic. And today we are continuing our series on what to do when you find an abandoned kitten that could be either stray or feral. Once again, this is your friendly reminder to hit that subscribe button. Please do leave us a like, guys, and leave us a comment below for other topics you want us to cover. Now, feeding a kitten that you find that's either feral or stray or abandoned or a rescue kitten is a really daunting task. And generally speaking, it's something that you have to plan for, but this responsibility can be sprung on you out of the blue, which can definitely take you by surprise. The three things that kittens need from you are warmth, which we've discussed in our previous video. They need to be fed and defecated manually, which we'll explain in today's video, and they need some veterinary attention as well. Now, when it comes to feeding kittens, you have to be very mindful of the fact that the younger a kitten is when you find them, the more frequently they have to be fed. However, each meal will be much smaller. So as a general guideline, a kitten that is less than a week old may weigh anywhere from like 50 to 150 grams, depending on the breed. It will also depend on their health and somewhat depend on their gender, depending on their breed as well. However, a kitten that is this small would probably have to be fed something around 5 to 6 milliliters of kitten replacer every 2 to 3 hours. So yes, that is a lot of feeding. So even if you space it out every 3 hours, you're looking at feeding them every 3 hours for 24 hours. So they need to be fed 8 times every day. And this includes feeding in the night. So you might have to employ the help of a... Okay, this part always makes me laugh when I explain it to clients. Sorry, I just broke character, I'm sorry. So you might have to ask for the help of a family member or a friend or a loved one or anyone who can help you undertake this huge responsibility. As always, like we explained in our previous video, the best option, if you can actually manage to find it, is, a foster mom cat. Now, as we explained before in our previous video, when cats do give birth to kittens, they have a very high surge in maternal hormones. So these cats usually often readily accept kittens. And kittens that are very young that need to be fed a lot would probably do best with a cat anyway, because they also need to be kept warm, and it is honestly very cumbersome for a single person to undertake the responsibility of feeding a kitten every 2 to 3 hours. Now, don't worry, because we will give you a feeding schedule for how often your kitten needs to be fed, and we'll also let you know what their weight range should be as a general guideline, and we'll also let you know when you can start putting your kitten on, solid foods. So that is essentially the beginning of the weaning process. But in terms of the actual feeding process, a few things to be mindful of. First, do not use cow's milk as a replacer for, kitten formula. The main difference between kitten formula and cow's milk is the amount of lactose. Kittens are actually not able to digest lactose as well as, humans can, who are not lactose intolerant. Kittens actually do digest lactose better than adult cats, generally speaking, but cow's milk is still something they don't readily accept, and they often come down with diarrhea. So therefore, most veterinarians advise going for a kitten replacer. Now, there are many different brands of kitten replacers out there. There's really no right or wrong. Some come pre-mixed for you, which is a real convenience. Others come in a powdered form. But the main thing you have to remember is you cannot store kitten replacers or kitten formulas once you've either made, the formula using the powder and adding on water, or once you've opened the pack, you should not store it for reuse. So for example, every time you feed your kitten, you would have to make, a batch from scratch. This is actually done to prevent food contamination for your kitten, because the longer the food sits out, even if it's in the fridge or whatever, the more time bacteria has to grow inside that food. And kitten replacer is actually very nutritious. And bacteria and other food pathogens love the nutrition in kitten replacer. So they will readily, go there, and they will use the kitten formula as well in order to, propagate. And they will do it much faster than you can keep up. And you obviously can't see them. And unfortunately, your kitten might get sick. Now, second thing you have to be mindful of when feeding a kitten that is either a rescued stray or feral is that you should place the kitten like on their belly, so flat down. So don't hold them up like upside down, or don't cradle them like this when you're trying to feed them. That is not advised, because they might actually get aspiration pneumonia, which is basically when fluids will enter the lungs because of the way they're positioned. In fact, Healthy kittens do have a reflex. It's called a righting reflex. So if a kitten is actually upside down or on their side, they have a natural reflex that they will try to flip themselves back up into the proper position, which is where they're on their bellies. And this is really important for them. So you should always try to feed your kittens when they are in that position. So don't try to, hold them upside down or cradle them like you would a human child when you're trying to feed them. Third, another reflex kittens have is called a suckling reflex. Now, this is actually also a very good indication of a kitten's health. Kittens that are very robust and healthy have a very strong suckling reflex. So, as the name suggests, the suckling reflex is essentially if the kittens feel there's something in their mouth akin to their mom's nipples, they will just start suckling right away. And this is a very useful survival mechanism, so they essentially know when to feed. So when you're about to feed your kitten formula, I actually recommend wrapping them in a towel of sorts. I'll explain why shortly. Like a very soft fleece towel is good. Make sure they're on their belly. And when you put the replacer inside a syringe, it usually comes with a nipple. If you don't have a nipple, that's fine too. It's really difficult to feed kittens with a spoon. I actually do not recommend it. If you don't have the actual bottle with a nipple in front, I would recommend using a syringe. Be very careful with the syringe though. You do not want to dart the milk into their mouth. You just want to slowly push out the milk. And you will notice that once the kitten actually gets a sense that there is food there, if the kitten is healthy, they will start suckling right away. So when you get this prompt from the kitten is when you actually start depressing the plunger slowly. Do not open their mouth and force it in and then try to squirt the milk inside. That is a really bad idea. It's very dangerous for their health because they might get aspiration pneumonia, which is where fluid will go into the lungs, which is really, really terrible for all cats, including kittens. Next, one very, very important step. If your kitten is less than 4 weeks old, sometimes even when they're around 4 weeks old, you might have to do this. You have to evacuate their bowels because kittens cannot do this. Like they cannot self-regulate their bowels until they're about 3 to 4-ish weeks old is when they start learning how to do this. They don't really master it until they're about 4 to 5 weeks of age. Now, the easiest way to do this is to take a nice, soft, damp piece of cloth. I like using cotton dipped in some warm water. You don't have to make sure it's wet, but if it's a slightly damp, it'll really help you. Usually after your kitten eats, what you want to do is turn them slowly on, hold them in their hands so they're slightly upright. You don't have to lift them off the ground. You can make sure that their hind legs are still on the floor a bit, so you just kind of lift them up slightly while holding them. And then you would have to rub their genital region until they urinate and defecate. Now, how often should this happen? So healthy kittens, when they're being fed, every time you feed them, after you feed them, they should urinate. Most people love to do this after they feed their kittens, so they will first feed them, then they will make sure they evacuate their bowels, so then they can clean everything up, like their face and their bum, and then put them back to sleep. You can do it before, but you can do it before if you wish to. There is no right and wrong, but then you just have to be mindful that you'll have to clean twice. So, once you evacuate their bowels and their urine, you'd have to wipe them clean, then feed them, and then clean their face as well before you put them back. Now, with regards to defecation, so urination is once per feeding time. So usually every time you feed them, they should urinate. They should defecate at least once or twice a day. The defecation itself, like their poop, should be like a yellow mustard color. It should be well formed. If you see anything in the poop that is looking really bizarre to you, for example, if it's moving around, if it does not look like a natural yellow mustard color, very close to what the formula looks like, or if you notice that your kitten is struggling to poop, even though you have no problem doing the same thing on other kittens and they poop just fine, you would have to take your kitten to the vet right away. Another very important thing to be mindful of, there is a condition known as atresia ani. Now, in essence, this means that the kitten has no anus. So when this happens, obviously the kitten cannot evacuate their bowel. So there are times where people have had, rescue kittens and they're feeding them diligently and they're trying to get them to defecate, but they don't realize the reason the kitten cannot defecate is because the kitten unfortunately does not have an anus. So there is actually no exit there. So the kitten just keeps getting bigger and bigger and bigger, and then they have to take the cat to the vet. Something you have to be mindful of, it's always good to check, as silly as it sounds, there is a possibility that a kitten you rescue might be having some genetic defects that you're not aware of. So it is something to keep an eye out for. Finally, another thing we always recommend before feeding your kittens at least once a day, so usually on the first feeding, is to keep a log of their weight. This is very important for kittens that are less than 4 weeks of age. They should actively be gaining weight or maintaining weight on a daily basis. If they're ever losing weight, especially if they're less than 2 weeks old, it is a very, very bad sign, and you should immediately take them to the vet. So usually in the first 2 weeks of age, kittens can actually double their weight. So a kitten that's born around like 100 grams, for example, before they hit 2 weeks of age, they should be over 200 grams in weight. So that's how rapidly growth is in the first few weeks of life. So if you ever notice your kitten that's really young is not putting on weight properly despite being fed properly and being urinated and defecated properly and being kept warm, you should take them to the veterinarian. And finally, the weaning process for kittens can start at around 4 to 5 weeks of age. This is when cats in nature will begin to wean their kittens as well. Once again, this is a very slow process and something we will discuss in detail in a future video. But just be mindful that if your kitten is 4 to 5 weeks of age, you cannot go cold turkey and just offer them wet food out of the blue. Your kitten likely would not even know what to do with it. Even if they did sample the wet food and ate too much, they might get, an upset tummy. So the change from, kitten replacer or any formula you have them on onto wet food during the weaning process will generally take you around 2 to 3 weeks. So you should not rush this process. And finally, if you do have, an adoptive mother cat and she decides to wean her kittens at around the same age, again, please be mindful of the mom's needs as well. Do not switch her back to her old cat food right away because she still needs a lot of, kitten food because kitten food is more nutritious to keep producing milk. Now, the science behind this is actually really fascinating because milk production in cats and actually even dogs peaks at around 3 to 4 weeks after they give birth. But this is also the time when they start to naturally wean their kittens or puppies. Now, the logic behind this is when they produce the most milk, yet they have an inclination that their kittens and puppies are not getting all the nutrition they need, so they start mixing in, live prey or meat or stuff like that. Another possible trigger is possibly because this is also the age at around which kittens and puppies do tend to get their canines or the long teeth, the fangs. So this might cue the mom that it's time to start slowly weaning them. Now, this is obviously something you'd have to keep in mind if you are using an adoptive mother to raise your feral kitten that you found. But it's also something that we always like to remind all pet owners out there that yes, you are raising a kitten, but if you do have a mom with those kittens, you should not ignore her needs as well. So that's it for this video, guys. Thank you so much for being a part of this series. We're not done with this series yet. We're still going to cover veterinary care for kittens that are under 4 weeks of age, and we're also going to cover, of course, the weaning process. From me, Dr. Luqman, signing off. I'll catch you guys on the next one. Bye, guys. I wish I could talk about more stuff, but I'll do it on the next recording. It's like, I don't want this to get too long.